Hi guys, I'm doing this presentation on HR 7010, which is the Increasing Access to Foster Care Through Age 21 Act. Sweet. So this act was introduced into the U.S. House of Representatives by Representative Judy Chu, who is from California, and she's a Democrat. And then the co-sponsor for this bill is Representative Erin Huchin, and she is a Republican from, I think, Iowa, if not Iowa, some state in the Midwest. If this bill is passed, it would amend the Social Security Act to expand Title 4E funding to include youth up to 21 years old. And it would make that funding accessible to all states. And then essentially this act allows voluntary reentry into the foster care system, so it's not obligatory for adults to be in foster care by any means, but it's an option for like a form of safety net. And ultimately, this whole system of reentry would be guided by the Secretary of Health and Human Services from the federal level to help child welfare organizations maintain best practice in helping reentry. And it would support the safety and well-being of youth aging out of the foster care system, because often this demographic is neglected by the child welfare system and social security system, and isn't adequately provided for. So some of the benefits of implementing HR 7010 would be it enhances the financial and emotional support for youth aging out of the foster care system. It's been shown that each additional year in foster care has increased high school completion rates among youth by 8%, and the probability of enrolling in college by 10 to 11%. And then also includes like ongoing work involvement, even if they aren't going to college, or even possibly not completing high school, they are working still, getting jobs that they're qualified for, whether that's skill-based or any other type of job, but they're working, which more than their peers who aren't in foster care long-term. And then there's also a raised likelihood that the youth is reporting a positive relationship with a social support resource like a social worker. And it's also reduced homelessness or couch surfing by 28%, teen pregnancy by 28%, and arrests by 41%, and convictions by 40%. So a big factor of knowing how about this population is knowing the intersectional identities that the demographic of youth aging out of the foster care system hold. And the two biggest or most common intersectional identities that align with older foster care youth, or just foster care youth in general, but applies to older foster care youth, is LGBTQ youth and Black youth. So, which are both marginalized identities. So Black children represent 14% of the US child population, but 22% of the foster care youth. So it's very disproportionate. It's a little less so with Native Americans. So I believe the actual statistic is 1% of the nation's children are Native American, and then 2% make up the children in foster care. And then LGBTQ make up 30.4% of the foster care population, and then 36.56% of Black foster youth identify as LGBTQ as well. So within the disproportionate amount of Black youth in the foster care system, 36.5% of that subpopulation identifies as LGBTQ. And then nearly 28% of foster youth over age 5 have a diagnosed disability. So that's also, all these are really important in factoring into different reasons why they would struggle long-term in establishing independent living skills and without the support of a larger system because of systemic issues. So, and this disproportionate representation has structural causes, which is based in systemic racism, generational poverty, all of that tying back to slavery and a history of racism in this country. And it also includes the potential bias in child welfare practices, so the social workers who are going into these fields, and then also the way that courts or the individual departments take in cases where the children are Black or Native or LGBTQ may influence whether they are actually removed from the home or not as well. And disability possibly as well. If they deem the parents or guardians unable to provide for that disability, that'd be another factor as well. This bill in particular won't address the systemic issues, but clearly, or the traumas that are found in these populations, but clearly acknowledges the need for the support as they transition out of care. So these people, this demographic, has a disproportionate amount of people who have higher needs due to being marginalized in general by society, whether that be in housing or in employment or in the educational system. And therefore, by supplying just an extra resource for them that is optional, we're serving the most marginalized as well as offering that resource to people who don't have an identity that's marginalized as well. This picture here is two former foster youth smiling as they participate in a program that is for foster youth 12 to 24 years old. So it really is focused around helping build life skills and mentoring relationships long term. It's called Happy Trails for Kids. So that was a cool program, cool picture, so I added it in. All right, so kind of going into that political sphere, there is bipartisan sponsorship for this bill through Democrat Judy Chu and the Republican co-sponsor of Aaron Hochin. And that's showing cross-party collaboration, which we love to see and is really beneficial to getting bills passed that are maybe struggling otherwise. So some of the Democratic appeal to this bill would be that it aligns with left-leaning priorities of expanding social welfare and addressing systemic inequalities in foster care. So wanting to ultimately help people and expand welfare and help establish human rights. And then a Republican appeal and tension is that it may be appealing to conservatives by promoting workforce entry and reducing long-term dependency on welfare systems. I think another thing is that if it's able to establish permanency, some Republicans hold like family values. So if you're able to establish more families through it, I think that could be an appeal as well. Depends on the Republican. And then a lot of Republicans, you might see some more resistance to it because it is expanding federal funding, and which would require more taxes and more government involvement, which in general Republicans are against. So, okay, some economic analysis. So, like I just was talking about, some political tensions around welfare expansion often center around economic concerns. But when addressing those concerns, you can highlight the cost of benefit data that actually lies in favor of an economic benefit long term. So Chapin Hall, which is a research group out of Chicago, estimates that the cost of extending foster care past age 18 would be $20,800 per youth annually. To cover foster home support, supervised living, and college aid. Ultimately, their diagram for like what this funding would include is more comprehensive than the policy that we're currently looking at, HR 7020, would encompass. So it would make sense if that estimate for cost might be a little higher than what it would actually be if you're just expanding foster care maintenance, which is like the monthly payments to foster care families, as a baseline. Like if that's all you're doing, not actually doing college aid and supervised independent living as well, you might be able to lower the cost a little bit. But either way, states would save $1,824 per individual per year, because that's how much, I guess that's not a net positive, but that's how much that they would typically be using in social welfare programs as is. So that's another expenditure that would be avoided through this program and this policy. And then recipients of extended foster care would actually be projected to gain $49,620 of lifetime earnings. That's like an average of how much more they'll earn over the course of their lives. And ultimately, that does outweigh the investment of reducing long-term care reliance on social services for them and future generations. So if you account for how many years you'd be avoiding the $1,826 of government welfare, which may expand if they have children, if these people have children, this demographic, and then adding in the positive, how much more they would earn, ultimately it balances out pretty well, and it ends up being worth it economically. That money does, the gain doesn't go back to the government directly other than taxes, but long term, it's economic growth, which is the right direction, and I think appeals to a lot of people on both sides of the political parties. So, all right, so some of the social sphere is that this bill aligns with the NASW Code of Ethics by upholding some of its core values of valuing human relationships and dignity and worth of the person. So ultimately it does that by saying that you're worth having family that you're worth having the opportunity to have family that supports you through a foster care family, and you're worth having a house and basic needs met like food and clothing. And then also tying back in that human relationships aspect of having a foster care family creates a lot more human relationships and with your foster family, but also with the social worker that is continuing care with you. And then it also promotes a relational approach by expanding social protective factors, which ultimately in the long term expand autonomy and the ability to make choices for youth who are aging out of the foster care system, because they'll have more resources to supply that autonomy. And then strengthening the social safety net reflects an ethical treatment by the government. So it's long-term individual success across life circumstances, not just requiring someone to try and fail. It sets them up for success long-term by giving them the resources that they need, and that other people who do succeed in life succeed in this sense, honestly, economically succeed in most senses, but also in the sense of being able to provide for a family. But it's supporting them to have long-term success, and that reflects ethical treatment of the individual. All right, so some past laws that have been that are associated with this bill would be the CAPTA, C-A-P-T-A. I don't know if you say CAPTA or you just spell the acronym, but that passed in 1974 that began to address child maltreatment in general, so acknowledging that child abuse exists, very important. And that was followed by some major legislation like Independent Living Program in 1986, Foster Care Independence Act in 1999, and the FFPSA in 2018, which all support older foster youth, but not to the extent that ideally we'd like to see on a federal basis. So expanding some of those funding options, but not to the extent that supports people fully. And then in 1994, an amendment to the Social Security Act allowed states to use Title IV or 4E funding for foster care training, administration, and maintenance. But that didn't ultimately expand to individuals who are 21, which is what this policy is looking to do. States nationwide have introduced bills to expand foster care access, including California's Assembly Bill 12 and 2010. I believe that's Fostering Youth to Success is the name of that bill, which extended care and financial assistance to youth aged 18 to 21. And they actually did a study to see if that policy was effective, and it found that youth who stayed in or returned to foster care showed improved outcomes in higher school and work engagement, better housing, reduced food insecurity and alcohol abuse, and then increased contact with social workers, which is a protective factor long term. So it worked, and that's what we'd like to see in this bill as well. All right, so some administrative considerations in the bill is that it will be requiring both federal and state governments to work in coordination with funding to distribute Title 40 funding. And then, unlike independent state programs, this multi-level approach adds administrative complexity. So a little bit more red tape, but it enables broader support in like federal funding, which is a lot more comprehensive. And then an actual implementation of offering reentry into the foster care system to youth, that would be overseen by the Secretary of Health and Human Services through the Administration for Children and Families, as it assists states in determining eligibility and how to distribute those funds to different child welfare organizations within the state. All right, some notes on human rights and social justice. So social justice is undermined, essentially, when an individual's fundamental rights, such as access to opportunity and fair treatment, in this case, are violated, especially for youth aging out of the foster care system. Article 22 of the Universal Declaration of Human Rights states that everyone has the right to Social Security for dignity and personal development. So that right is often unmet for former foster youth in the way that they're not provided with dignity, which would be established by having basic needs met, and they're not given Social Security to help them reach those goals and maintain dignity. Article 25 of that same document outlines the right to adequate living standards, including food, shelter, and health care. And that is also unmet frequently by this vulnerable group because there is no extended care. After you turn 18, you lose all of the care that you would otherwise have. So expanding foster care access through age 21 would strengthen the social safety net and help uphold these human rights. Some stakeholders, including a letter about HR 7010 from CWLA and Youth Villages, emphasizes the widespread backing for this policy by state and federal organizations across the country who are in favor of human rights and supporting foster youth. This policy does promote equity. It does not explicitly address concerns about race, gender identity, sexuality, or disability, which leaves room for bias, if we're being honest, in this policy. But that would go into like actual implementation of the policy. All right, so when evaluating its effectiveness, this policy lacks a defined evaluation method, but it could be done through some of the methods that we saw in the California study through Chapin Hall. And that includes both qualitative and quantitative data. So some qualitative questions could be like, do you feel safe? Are you satisfied with your life? And then some quantitative would be more like, are you employed? Have you finished education? Are you continuing education? Are you like actively consuming food? Like, what's your budget for groceries for the month? I guess could be another quantitative question. And that would ideally be tracked with before and after policy implementation through social workers meeting with their former or current clients. This mixed method would provide a comprehensive picture of the policy's impact on young adults aging out of the foster care system. However, potential unintended consequence would be an increased stress on an overburdened child welfare system with no clear plan for addressing workload, worker safety, or intersectional equity in implementation. All right, so just some alternative recommendations is that to actually require states to implement expanding foster care access to 21, this just incentivizes it by providing funding, but it doesn't require them to follow that. I think that should be standard across the country. A stronger bill would mandate this state participation, and address some systemic issues like caseworker burnout by increasing pay, reducing caseloads, and improving supervision. Section 7 also lacks enforceable workforce development measures, so it doesn't really cover how we're going to help these youth gain employable skills. It just says that it's going to be created by the Secretary of Human Health and Family Services, the secretary that I mentioned earlier. And then it doesn't also include any supports like subsidized housing or college tuition aid, which we saw in the California bill and would be really good to implement here as well. And then once again, modeling the California's Fostering Connections to Success Act from 2010, the bill should guarantee financial, educational, and emotional support, upholding the rights of youth transitioning to independence. The human rights of youth. All right, so just some kind of final thoughts to really tie together of why this bill would be effective and is crucially important moving forward, is that it's increased high school credential completion rates by 8% and boosted college enrollment likelihood by 10 to 11%. I mentioned some of these earlier, but I'm going to repeat them again because just really driving it home. It's improved employment outcomes with more quarters worked between ages 18 and 21. It's raised average savings with youth holding $404 more in their bank accounts than before. And then it strengthens social supports with more youth identifying a professional as a key support person, reduced reliance on need-based food assistance by over $700 on average, decreased economic hardship by about 12%, and significantly lowered homelessness or couch surfing by 28%. So lowered early pregnancy by 28%, and arrest and conviction rates by 41 and 40% accordingly. And then between ages 17 and 21. So it is effective, and it's been effective in states where it's already been implemented on a statewide scale. So we need to expand that to a national scale to support all youth. Here are some of my references. Actually, all my references. And then thank you for listening. A cool quote I found is, "The test of morality of a society is what it does for its children." So yeah, just think about that, and thank you for listening.